Federal health officials are warning a drop in vaccinations in the U.S. may have led to an increase in pediatric flu deaths. CBS's Jared Hill has more.
Ready?
Amanda Roost loves a good fall day at the park with her kids, but she says preparing for flu season is serious business.
We're traveling, we're going to be exposing them to all different kinds of people in different scenarios. We are subjecting them to that. I feel like we're kind of responsible for getting them covered.
Federal health officials are getting the word out that flu vaccination can be life-saving for children, and now is the time to do it. The CDC reported nearly 200 children died from the flu last season. Most were eligible for the flu vaccine, but did not receive one.
I think, unfortunately, coming out of the COVID pandemic, we have seen a rise in vaccine skepticism, people less willing to get vaccinated. And as we've seen with the pediatric flu vaccines, that has led to increased hospitalizations as well as, unfortunately, some deaths.
The American Academy of Pediatrics recommends everyone 6 months and older get the annual flu vaccine. But the uptake was down last year. Just 54% of kids got vaccinated.
Sometimes, say before Thanksgiving, say mid-November, you want to get your flu shot, your COVID shot. But that said, whenever you can get it done, you should get it done, even if it's a bit earlier than that.
Children under 5 are at high risk for flu complications, as well as older adults, pregnant women, people with underlying conditions like asthma, diabetes, and heart disease, and the immunocompromised.
My kids who can sustain it can contribute more to keeping the flu at bay.
They're protecting themselves and their community. Jared Hill, CBS News, New York.
The Food and Drug Administration just announced the FluMist nasal spray vaccine will become the first self-administered flu vaccine that can be done at home. That vaccine not expected to be available for the upcoming flu season, though. Doctors say the vaccine is not as effective as the traditional flu shot historically. A Harvard University survey reveals over a third of former NFL players believe they have CTE. The study, covering players from 1960 to 2020, found many reporting cognitive issues, headaches, and low testosterone. CTE, linked to repeated head impacts, can only be confirmed post-mortem, that is. The lead researcher emphasizes that while CTE itself is untreatable, many symptoms can be managed medically.
Positive change. While we can't go back and change the fact that they had head injury, and we can't know if they actually have it, there's actually so much that we can do that we learned from this study, such as, can we go after their low testosterone, their depression? Can we go after sleep apnea? And all these things that are actually impacting their cognitive function now that we can do something about.
Symptoms of CTE include cognitive impairment, behavioral changes, mood disorders, and reduced motor function.